Could the pills you take every day be silently damaging your brain? Millions of people rely on medications for pain, sleep, reflux, and anxiety, often assuming they're completely safe. But shocking research reveals that several common drugs are linked to memory loss, cognitive decline, and even dementia. What's more disturbing? Many doctors themselves avoid these medications, knowing the long-term risks to brain health. In this video, we reveal 5 drug categories scientifically associated with dementia. We'll explain how they affect your memory and offer safer alternatives that could protect your brain. Watch to the end, it might just save your future. Number 1. Proton pump inhibitors, hidden threats in your heartburn pills. Proton pump inhibitors, or PPIs, are commonly prescribed for acid reflux, GERD, and heartburn. You'll recognize names like omeprazole, Prilosec, esomeprazole, Nexium, pantoprazole, and lansoprazole. While they provide fast relief, PPIs reduce stomach acid, which your body needs to absorb essential nutrients. Long-term use has been linked to deficiencies in vitamin B12 and magnesium, both crucial for cognitive function. B12. Deficiency alone can lead to memory problems, confusion, and even permanent nerve damage. But it doesn't end there. A study in JAMA Neurology found that long-term PPI users face a 44% higher risk of developing dementia. These drugs disrupt the gut microbiome and cause systemic inflammation, an under-recognized pathway contributing to brain degeneration through the gut-brain axis. Seniors are especially vulnerable. PPIs can impair calcium and iron absorption, leading to brittle bones, fatigue, and frailty. Even worse, stopping them suddenly can cause severe acid rebound, creating a cycle of dependency. What can you do? Consider lifestyle changes. Eat smaller meals, avoid late-night eating, cut caffeine and alcohol. Some find relief using apple cider vinegar or switching to H2 blockers like famotidine, which may carry fewer cognitive risks. Long-term PPI use requires careful evaluation. Talk to your doctor about safer options that support both digestion and brain health. Number 2. Benzodiazepines, the memory thief masquerading as a calm. Benzodiazepines, also known as benzos, are prescribed for anxiety, insomnia, seizures, and muscle spasms. Common names include Xanax, alprazolam, Valium, diazepam, Ativan, lorazepam, and Klonopin, clonazepam. These drugs enhance GABA, a calming brain chemical. But prolonged use causes dependency and tolerance, dulling mental sharpness over time. Studies show long-term benzodiazepine use increases dementia risk, especially when taken for longer than 3 months. They impair the hippocampus, the brain's memory center, and reduce your ability to learn and recall information. In older adults, the risk is higher. These medications are linked to increased falls, confusion, and even hospitalization. And withdrawal is serious. Stopping suddenly can cause seizures, panic attacks, and insomnia. What are the safer options? Cognitive behavioral therapy, CBT, is highly effective for anxiety and insomnia. Practices like mindfulness, deep breathing, and guided meditation offer lasting results. For sleep, natural aids like melatonin or magnesium may help without harming your brain. Benzos may calm you today, but they could cost you your memory tomorrow. Reassess their use under medical guidance. Number 3. Statins, heart help with a hidden cost. Statins like atorvastatin, Lipitor, simvastatin, and rosuvastatin, Crestor, are used to lower cholesterol and prevent heart attacks. They work by inhibiting cholesterol production in the liver, but cholesterol isn't just a heart issue. Your brain relies on it too. Cholesterol supports nerve function, neurotransmitter production, and brain structure. Lipophilic statins, for example simvastatin, atorvastatin, cross the blood-brain barrier and may impair these processes, leading to brain fog, forgetfulness, or confusion. In 2012, the FDA issued a warning about memory loss linked to statins. While some evidence suggests statins may help those with vascular risk factors, the cognitive side effects, especially in older adults, are real and worth monitoring. Hydrophilic statins like pravastatin may be safer for the brain due to limited brain penetration. If you're on statins, don't stop abruptly, but talk to your doctor if you're using them preventively or experiencing memory changes. Natural strategies like eating fiber-rich foods, exercising, and taking supplements like red yeast rice or berberine can also support heart and brain health. Remember, your heart and brain both matter. Protect them equally. Number 4. NSAIDs, relief now, risk later. NSAIDs, non-steroidal anti-inflammatory drugs, include familiar names like ibuprofen, Advil, naproxen, Aleve, diclofenac, and indomethacin. They're great for temporary pain, but long-term use can impair brain function. NSAIDs reduce inflammation by suppressing prostaglandins, but those same compounds are critical for maintaining blood flow to the brain. Over time, reduced circulation can lead to cognitive decline. Long-term use also increases the risk of high blood pressure, stroke, and microvascular damage, each a threat to brain health. Additionally, NSAIDs can harm the kidneys, stomach lining, and gut health, all of which indirectly affect your cognitive well-being. Indomethacin and diclofenac carry particularly high neurotoxicity risk. Safer pain management alternatives include turmeric, curcumin with black pepper, ginger, omega-3s, acupuncture, physical therapy, and yoga. Chronic pain is real, but long-term NSAID use could be hurting more than it helps. Seek brain-friendly alternatives. Number 5. Anticholinergics, silent saboteurs of memory. Anticholinergic drugs block acetylcholine, a neurotransmitter essential for memory and learning. These medications include diphenhydramine, Benadryl, amitriptyline, oxybutynin, hydroxyzine, and scopolamine, used for sleep depression, bladder control, and allergies. Studies show these drugs can increase dementia risk by up to 50%. Brain imaging reveals structural brain changes, especially shrinkage in the hippocampus, in long-term users. The danger lies in cumulative exposure. Over 600 medications carry some level of anticholinergic activity. Even low doses across multiple medications can add up, accelerating memory loss. Side effects can mimic dementia, confusion, blurry vision, constipation, dry mouth, and even hallucinations. Often, these symptoms lead to further prescriptions, creating a cycle of cognitive decline. What are your options? Switch to non-anticholinergic alternatives. For sleep, try valerian root or melatonin. For allergies, use loratadine or cetirizine. For bladder issues, explore pelvic floor therapy or newer, lower-risk medications. Acetylcholine is vital to your mind. Don't let medication quietly erase your memories. What to do if you're taking these drugs? If you're currently on any of these medications, don't stop cold turkey. Abrupt withdrawal, especially from benzos or anticholinergics, can be dangerous. Here's what to do. Consult your doctor. Ask if a gradual tapering plan or safer alternatives are appropriate. Keep a medication list. Include prescriptions, over-the-counter meds, and supplements. Update it often and bring it to every appointment. Request cognitive monitoring. Your doctor may recommend periodic memory or focus testing to catch early changes. Being proactive today could prevent irreversible decline tomorrow. Medications can heal, but taken long-term without oversight, they can harm. The very pills meant to help your stomach, your mood, or your sleep may silently be increasing your risk of dementia. The solution isn't fear, it's informed action. Review your medications regularly. Ask questions. Explore natural, research-backed alternatives. Your brain is your most valuable asset. Protect it wisely. Have you taken any of these medications long-term? Comment below if you've noticed memory changes or successfully switched to safer options. Share this video to protect someone you care about. Subscribe for weekly doctor-reviewed health tips, because your health deserves clarity, not confusion.